The Youth Access to Psychiatry Program is a grant-funded program to provide resources to primary care physicians and other providers in the state of South Carolina to help them manage the behavioral and mental health issues that they see in their patient population.
I think a lot of times primary care physicians and primary care providers feel very nervous, very inadequate about if they're evaluating properly, if they're treating properly, if they know the meds, what interactions, the pitfalls. The YAP-P program provides just a lot of support for the primary care docs, not trying to assume care, but to enable them to move forward with things that they're quite capable of doing themselves.
We provide a continuum of supports, including patient and family education materials, training, and other resources to primary care clinicians and their staff, as well as a consultation line which connects primary care providers directly with a child psychiatrist or a developmental behavioral pediatrician to help them discuss specifics of cases that they have that they might need some guidance on.
We have 10,000 child and adolescent psychiatrists in the whole country, and there are some 15 million children and adolescents who may need help. There's usually a wait of 3 months, 6 months, or even longer to see a psychiatrist. So most of them do see the pediatrician, the nurse practitioner, or physician assistants. So we come into play when they have questions or want to kind of look into other treatment options or to better manage or even to assess.
Essentially, there are two ways that you can access a consultation with YAP-P. One of them is by filling out a form that we have online on our website, or they can call our phone line and talk directly to our intake coordinator. We set up a time for them to talk with our consultant, either a child psychiatrist or a developmental behavioral pediatrician.
So they call us, it takes about 5-10 minutes most of the time, and it's readily available. So they can, without any cost, for free, reach a child and adolescent psychiatrist and get a consultation.
And you're able to discuss this patient in depth, either the evaluation, the ongoing evaluation, the current treatment, recommendations for treatment, and the opportunity for follow-up. We oftentimes were able to provide these visits the same day. And I think that's the thing that the primary care providers really liked and really appreciated. Just how easy it was, how pain-free, and how quickly we were able to answer their questions and help direct the evaluation and treatment.
I think one of the reasons that it is such an effective service is that there's such a shortage of mental health providers right now. And this really allows us to use our expert mental health professionals in a way that helps those in need most. So those primary care providers who are stuck with something or don't know how to do something, they have that ability to call and get same-day consultation for themselves if needed.
We have the knowledge and we have the expertise, and we are really helping build competencies in the field. We are really making this accessible, available, so children have access to care when they cannot see a psychiatrist.
We're here to bolster up the work of our primary care workforce and help them provide better care to their patients and make their patients feel that they really are very confident in the services that they're getting from their providers because they know they have access to specialty services when needed.